So I am so honored to be able to introduce Dr. Dadlani. He is the chief of pediatric cardiology at Nemours Hospital. And I know many of you have heard about the electrocardiograms that we are now doing for all of our student athletes. So we just want to kind of talk to you a little bit about that and keep you informed. Thank you so much.
Yeah, thank you for the opportunity to be here today. It's an honor and a privilege to be here, and I hope in 30 minutes I can teach you how to read an EKG and what your, learn about how your kids' results could impact them over time with this. So I am on the American Heart Board, and I do read EKGs for who we play for on a voluntary basis with this. So I just wanted to disclose those. And objectives today, usually medical students learn EKGs over about a 2-week period. So I've taught both in Tampa and here in Orlando. And we're going to do it all in 30 minutes or less. So we're going to ask for some volunteers here to read some EKGs that have been done in your school district here. But we want to make sure everyone leaves knowing what the most common causes of sudden cardiac arrest are in student athletes. And different forms of cardiovascular disease that can be picked up on screening EKGs with that. So why should we care about cardiovascular disease? How many of us in the room either have some form of cardiovascular disease ourselves or have a family member? So we just got more than 2/3 of the room here, okay? We should care about cardiovascular disease in ourselves, not only our kids, but in ourselves, because 1 out of 3 of us is going to pass away from some form of cardiovascular disease over our lifetime. Be that a heart attack, be that a stroke, be that a blood clot. So if you just look in your own family and family members that have passed, many of them probably passed from a cardiovascular cause. Our goal as medical providers is to try to reduce that number over time. And it takes a whole community in order to do that. So screening in schools for cardiovascular disease is one form of lowering that risk over a lifetime. But it's estimated that more than 70 million Americans have some form of cardiovascular disease with that. And we want to catch as much as possible. It's in Brevard schools. So from a high school standpoint, there's over 7 million high school athletes on an annual basis in the United States. That's a lot of students when you look at that. Okay, and there's over 400,000 college athletes with that. Our most common form of cardiovascular disease in young athletes will be high blood pressure. But hormonal changes that occur during puberty can also precipitate risks with intense training, so that student athletes may be in a higher risk category than some other kids that aren't athletes. So when we look at all causes of sudden cardiac death, there's not a national registry in the United States. So this is a retrospective review of patients who have passed that Dr. Marin does out of Minnesota. And they look at patients throughout the United States that pass away as a student athlete with that. And if you were to draw a line down here, half of this pie chart is this thing called HCM. Called hypertrophic cardiomyopathy, where you develop an abnormal thickening in the heart. Over 95% of the time, you can pick that up on an EKG. There are some things you cannot pick up on an EKG. The next box called coronary abnormalities, if you're born with an abnormal coronary artery, you can't pick up. And many of the rhythm issues here you can pick up with that. So EKGs are very good at identifying some causes of sudden cardiac death, but not all with that. When we look at the American Academy of Pediatrics, they have a list of all the causes of sudden cardiac death here for you. Again, hypertrophic cardiomyopathy is listed up here at number 1 with that. All the other ones are broken down for you. Now, again, there's no national database of high school students, but there is a national database of every NCAA student in the United States. So if we took all NCAA students that pass away from any form of death, accidents are going to be number 1. So again, you have college students here, so motor vehicle accidents, motorcycle accidents, people doing crazy stuff at frat parties, sorority parties, other things, right? So you have accidental deaths that occur with that. From the medical deaths that occur, many of them occur with exertion. So their symptoms come on when they're exercising up at peak exercise, with that more than 75% of the time. Sorry, this one's a little dark, but our most common causes of, and this is from the American Heart Association, but the most common causes of sudden cardiac arrest during sports, the highest risk sport is basketball, swimming, lacrosse, football, all in that order. So basketball is number one, okay? Just so that everyone's aware. Again, these are NCAA athletes, okay? With that. Now, the American Heart Association recommends for all student athletes getting a 14-element checklist done. So when you go to your pediatrician to get your school physical done, you know, they will ask certain questions in the personal history, in a family history, and then also do a physical exam for that. So every student prior to sports participation should make sure they get all three of those things done to be able to detect who's at higher risk than others. Sorry, our clicker's a little slower. All students also get a pre-participation sports physical form filled out. Please, 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 if I can give you one recommendation to take home, don't just look at this form and check note everything. Please read the questions, okay? If you have a family history of someone with hypertrophic cardiomyopathy that we just talked about, there's a 50% chance the next generation also has that. 50, okay? That needs to be checked off on that list. If someone's died in the family or has any type of significant heart disease, please make sure it's there. Many times when students come in for their pre-participation sports physical, again, the family fills this part out. The medical providers aren't filling this out. But all we see is a line drawn straight down. And we know they did it 2 seconds before they walked into the room and are just handing it there. And probably never even read any of those questions with it. Okay? But that's a great way to flag who may be at higher risk than the other students sitting next to them. Okay? But make sure that's really read and filled out appropriately. And don't let your kids fill it out, please. Okay? Because they probably didn't know what a second cousin passed away from, on one side of the family versus the other with that. See if we can get this. There we go. So back to the NCAA. Again, when you do EKG screening in the NCAA, so Division I schools have done EKG screening, what do we expect? So Brevard just rolled this out last year. What do we expect for our student athletes based on this with it? So if you took 5,000 Division I students here that underwent EKG screening, what you're going to find is your abnormal rate's going to be less than 5%, okay, for a screening process. And less than 1% will have critical heart disease, meaning they have a form of heart disease that's going to put them at potential risk for sudden cardiac arrest with that, okay? So now let's do some EKGs. I'm sorry, your name is?
Patricia.
Patricia. So we thank Patricia for being one of our volunteers here. And we're going to prove that in 10 minutes you can learn how to read EKG here, okay? And then I'm going to show you examples of EKGs that were all found right here in Brevard County. So number one is, your child's going to come home with an EKG, okay? It's going to say normal or abnormal on it. If it's normal, right, most of the time, again, 95% of the time, that child has no cardiac disease. But we know there are some forms of cardiovascular disease that won't be picked up by an EKG. So just remember that, okay? Even if your child has a normal EKG, a small percentage can still have an underlying heart issue, okay? It does not pick up 100%. If it's abnormal, okay, you're gonna have, again, the critical ones being those that have heart disease that can cause sudden cardiac arrest, be about 1% out of this. But you're gonna have, again, 4% be abnormal but not cause critical heart disease with that, okay? So that's what we expect when we do the screenings, and that's what, so far, the first year of this has yielded here with us. So now let's look. Patricia's gonna help us read this Aaron's EKG here. with that. So the one way that I always like to explain the heart to families, okay, when I meet them, is just to think of the heart as a box. So how many people took high school biology? Okay, we probably all repressed the anatomy of the heart here, okay, if you haven't used it in the last 20 years, okay? But let's go through it really quick here. But we have 4 chambers. We have a right atrium, right ventricle, left atrium, left ventricle. Okay, our right side takes unoxygenated blood and pumps it out to the lungs. That blood flow gets oxygenated, and then it gets returned back to the left side with oxygen, and the left atrium, left ventricle take that blood and squeeze it out our aorta to supply our whole body then with oxygenated blood. Because we have essentially 2 pumps here in the heart, we have to make sure those 2 pumps beat at the same time. You cannot have one side squeezing and the other side just sitting there. They're sharing a wall together. So in order to coordinate the squeeze of it, there's an electrical system in the heart. And that's what our EKGs are picking up for us. So there's an area on the right side called our sinus node that acts as our pacemaker. So it's firing out this electrical energy. That electrical energy travels around on little nerve fibers or wires that run through the atrium and come to the AV node, which sits in the center of the heart. The AV node's job is to slow that electrical energy down because these upper chambers need time to allow this electrical energy to go down. And that electrical energy rushes real quickly down the lower chambers, and then it spreads out across our heart muscle on both the right side and on the left side. So electrical energy goes from point A to point B all the way down to point C. That's all an EKG is picking up for it. Okay, so Patricia's going to look at this EKG here and give us our results here. Okay, so let's just say this is Aaron's EKG, right? So we have this first wave, and in medicine it'd be really nice if we named it A, B, and C, but nothing's that simple. Okay, so for Patricia, our first wave would be electrical energy going where? If it started here. Yeah, so this is going to be our upper chambers here. So this first wave we get is our upper chambers getting electrically excited. Okay? Then electrical energy came to the center of the heart. So this is going to be our AV node, center of the heart. Then we get this huge big spike called our QRS, which is electrical energy rushing down the lower chambers. And lastly, we get this wave called our T wave, which is electrical energy clearing all of our heart cells out here. Your T wave tells you the health of your heart muscle. If you flip a T wave, you got a heart muscle problem. Okay? So we're going to go look at some of these EKGs. So now this is Aaron's EKG. Let's say this is Aaron's EKG here, Patricia. So we're going to read here, and I know this is small if you're sitting in the back of the room, but you got P, QRS, T. Okay? P, QRS, T, P, QRS, T, and it goes all the way across, P, QRS, T. Okay? So now let's say Patricia's standing right here on Aaron. Okay, because we put those little leads all across our chest. If I put a lead here on Aaron, okay, and my electrical energy is all going this way, away from us, any electrical energy going away from us is all going to be negative. Okay, it's all going to go down. So V1 here sits right here, and everything goes away from it. V6 down here is put way over on Aaron's left side. Okay, so all of his electrical energy should be coming towards him. So all these waves should be nice and upright in V6. Okay, that's all you got to know. You got to know there's a P, a QRS, and a T, and V1 looks good and V6 looks good. Okay, we're going to go look at examples now. So what do we got here, Patricia? We got a P, QRS, yeah. And then we got this T wave. Okay, and we got that all the way across. So we know our rhythms. We got a normal rhythm. Okay. Now in V1, we got this stuff all up here, okay? In V6, we got these huge forces over here, okay? And then if we come and look at our T wave on V6, we got these funky T waves that are all over the place here. Okay, they're up, they're down, okay? So, is Patricia's big moment here. You ever get normal or abnormal?
I would say abnormal.
Perfect, let's all give her a hand. So you just saved a child's life by doing this, okay? This child had hypertrophic cardiomyopathy, okay? They develop thickening of the heart muscle, okay? It can be in one place, it can be the whole heart, okay? Each child is different with that. Your symptoms of a hypertrophic cardiomyopathy, if you're a teenager, you can present with no teenager should present with a new murmur. Okay? If you're taking a teenager in for a well child exam and they all of a sudden have a new heart murmur, they go get worked up because you don't know that they don't have this. Okay? Babies commonly have murmurs. Your teenager should not have a new murmur. Okay? Develop as a child in the teenage years. Shortness of breath with exertion or chest pain with exertion are other symptoms. So if they're running and they get short of breath or they pass out with exertion, go to the next one, would be the things that we worry about. But 1 in 500 people will have a gene for hypertrophic cardiomyopathy, so it's more common than you think in the community, okay? With that. So who'd like to be our second contestant today? You just won the prizes, right? And what's your name? Pleasure to meet you. Thank you for volunteering today. So Lisa's our second contestant here, okay? So we got this EKG up, again, done at a Brevard County school. You have P-wave, QRST, P, QRST, all the way across. So we got a normal rhythm, okay? In V1, everything's coming down. V6, coming up, but this T wave's way out here and kind of flipped. What are you gonna call it? Normal or abnormal?
Abnormal.
Abnormal! Guess what? She just saved another life, okay? Fantastic. Wanna go to the next one? So this patient had a condition called long QT syndrome. So patients, some people will be born with a genetic defect where the electrical properties of their heart need these little channels called ion channels, where they let either sodium or potassium or calcium into the heart to electrically excite it. And if you're born with an abnormality in one of those, you can get changes on your EKG where the distance between this Q wave and the T wave lengthen compared to normal. And that can put you at risk of going into sudden cardiac arrest. Again, if one person in the family has this, it can also run dominantly in families. So multiple people can have this. Okay, so one child was picked up with this, but what they found was there was 3 other ones in the same family. Okay, so you had a 12-year-old girl who was singing at a chorus event, drop, EKG, long QT, because she went into an abnormal heart rhythm called ventricular fibrillation. Okay, had to get shocked out of that. And her family has long QT. So not only she got diagnosed, but 2 of her siblings got diagnosed with this. Okay? Who wants to volunteer to be third? Monica, thank you for coming on. Here we go. Okay, so this is our next EKG. So you got a P wave, a QRS, a T, a P, a QRS, T. You got a P.
So what's that second one?
Well, it's lengthening here, right? It doesn't look the same, right? And then you got a little blip on the back here. And then you got a P, a QRS, and a T. And then you got a P, but this distance doesn't look the same as this distance, right?
Okay, you said you wanted to teach us.
Yeah.
So I'm gonna go with, y'all have been paying attention, right? So the examples that I remember you showing us, there should be the same distance on that, or pretty much close to.
I agree.
So if I look at this and I see your P, QRS, and the T, then they shouldn't be right on top of each other. So they're on top of each other, and then there's this huge gap, and they're back on top of each other. So I'm gonna guesstimate, but you're the specialist. I'm saying there's probably a problem there.
Exactly. So you're going abnormal.
I'm gonna go with.
Crowd, what do you guys think? Abnormal, there we go. Nice, okay, thank you. I'm going to the next one. So this child has heart block, okay? So you can have, again, this was a child playing sports. Didn't know, okay? Totally picked up this EKG. So this child has a disease in the AV node. So normally beats cross from the top through the middle all the way down. Some people will inherently have a disease process that affects this AV node so that not all the beats can get across in a normal manner. So some people, first degree block means they slow down going across there, so the length is a little farther. Second degree block, you start dropping beats with that, and that's what this child had. And third degree block means no beats go across. So upper chambers beat and then lower chambers beat separately, but they never talk with them. So this child's at risk for going from second to third degree over their lifetime. So they'll have to just get followed. They can keep playing sports, but they're going to get followed over their lifetime because later on in life, as an adult, at some point, they'll probably buy themselves a pacemaker. Later in, okay? Let's keep going down. Okay, we got case 4 here. Who wants to do this one? Bonnie. Okay, so Bonnie's our next contestant up here. So we got a P, a QRST, P, QRST, B, QRST, P, QRST, P, QRST. They got a normal rhythm coming across, okay? But you got these wide beats up here, right? So if you come up here on lead 1, you got a P and then this wide stuff. You don't have that nice little flat line that you typically expect. And over here, too, you can kind of see this thing's all wide. So you say normal or abnormal?
I'm gonna go with abnormal.
Abnormal. Crowd, what do you guys think? Abnormal. So this child has a condition called Wolff-Parkinson-White. So anyone in the room have SVT or supraventricular tachycardia where you have your heart race? One? Okay. So when you have normal heart electrical system, all of your electrical energy from these upper chambers should funnel through the center of the heart and then go down. Some people, though, will be born with an abnormal extra little pathway. It can sit on the right side or the left side of the heart. And if you go into, as electrical energy goes down the normal route, then it can cycle back up and create a loop. So these patients will go into sudden episodes of their heart racing. I don't know if that's what you experienced. Yeah. With that. So these can be cured by going in and doing an ablation procedure. So you take a catheter up into the heart, find the extra pathway, and zap it with some electricity or freeze that little area. And then you're permanently cured. And then you don't have to worry about medications or anything ever again. Some of these pathways, though, will allow electrical energy to pass from the upper chambers down to the lower chambers. So how many people here have a family member that's ever developed AFib? Okay, I do too. Okay, so a large percentage of the room. AFib means you go into a fast heart rhythm between these upper chambers that's usually going at a rate somewhere close to 300. So it's firing away real fast. Luckily, the center of your heart slows that electrical energy down and saves you. Because if you went 300 right to the lower chambers, you'd be dead in 4 minutes. But usually, the center of the heart slows that so that your rate's 150, maybe just a little over that. So you feel uncomfortable like you just ran a mile, but you're not dead, okay? But how many people have had a drink, had a couple drinks, alcoholic drinks maybe, and all of a sudden felt your heart kind of flutter maybe the next morning or at night? Anyone? I know probably there's a few other people out there. You had a little run of AFib, just so you know that. Alcohol induces AFib, okay? If you have one of these pathways and you go into AFib, if you're a college student and you go out and you binge drink, right? You go into a little run of AFib, it goes right to your ventricle, you're dead in 4 minutes. Okay? Sure. So these kids get an ablation procedure to get rid of that pathway, to save their life, okay? So they run a 1% risk of sudden cardiac arrest every year to their life with that. But their EKG has this classic kind of upsloping on it, okay? Want to do another one? Okay, good. Okay, so here we go. So Bonnie's helping us out with the second one here. So we got P, we got QRS, we got T, P, QRST, P, QRST. Normal, okay, I like it. V1, everything going down. V6, everything coming up. So what are you going to say, normal or abnormal?
That looks normal.
Crowd? Normal, perfect. Okay, next slide. So this child had a totally normal EKG, okay, but can have a coronary abnormality, okay? So what's a heart attack mean to you, Bonnie?
Your heart stops.
So on a heart attack, off of our aorta, where our oxygenated blood is coming off, we have two little arteries called our coronary arteries. And they supply our heart muscle with oxygen and nutrients. Okay? Over our lifetime, if we smoke, if we have diabetes, if we have high cholesterol, we can build up sludge or plaque buildup in these arteries. Okay? So a heart attack means that one of these arteries gets completely blocked with sludge. Okay? So if you've ever had a family member that's had to have a cath or bypass surgery because of coronary disease, that's because they built up blockage in one of these arteries and their heart muscle wasn't getting enough oxygen with that. Okay. Some kids can be born, and normally our coronary arteries, one comes off on the left, one should come off on the right. Some kids, though, will have both come off on the left. And if that happens, and you're exercising, your arteries expand during that time, so you can see this artery is going to get pinched here. Okay, but you'll have a normal EKG with that. Okay, so just realize EKGs will not capture every form of heart disease. Okay, go on to the next one. Okay, gonna do another one too? Okay, I'm sorry to throw them all at you. Okay, B-U-R-S-T, B-U-R-S-T.
Little difference there.
Little difference here, right? So we got a little extra beat thrown in here. Okay, how many people feel extra beats in themselves? You know, maybe you have a couple cups of coffee, maybe you have an energy drink, right? All of a sudden you kind of feel an extra beat. 10% of us as normal healthy adults will have occasional extra beats, okay? We wouldn't restrict sports for this, but not a normal EKG, okay? Want to go on to the next one? So you can have extra beats from the upper chambers like we just saw there, that these were premature atrial contractions, or you can have extra beats from the lower chambers with it. Again, no one's gonna pass away from these, but again, not a normal EKG, okay? You wanna go to the next one? So thank you, Bonnie, for helping us out today, and all of our other contestants. But I hope I left you within 30 minutes here that hypertrophic cardiomyopathy, your most common cause of sudden cardiac arrest, and can be detected very clearly by EKGs. The sports with the highest risk of sudden cardiac arrest will be basketball. In EKG screening programs, when you look both in college and around the country, you're going to expect 95% to be normal and 5% or less to be abnormal with that. And they're very good at detecting hypertrophic cardiomyopathy, some forms of arrhythmia, Wolff-Parkinson-White as you saw, but it is not 100% with that. Okay, so if your child is having symptoms or you have a strong family history, you got to make sure your child is getting seen appropriately. I hope that helped you, and I hope you got EKG 101 in less than 30 minutes, so I hope you can all go out and read your own EKG now.
So we have a couple questions. Okay, we can take a couple. Come on, step up here. If you could do it, get in line, that'd be awesome.
My question is, I know Brevard County is requiring 7th graders and older. At what age should you actually test your children? So at 10, 12?
From a policy standpoint, I would leave all those questions to the district and stuff
Well,
with that.
as a suggestion, if I
It depends
wanted
on your
to,
family history, right? So if someone had a family member that had long QT or hypertrophic cardiomyopathy, we follow them annually through puberty.
right.
For that. So those kids get, if there is any potential that they're a gene carrier for one of those processes, they get seen on an annual basis.
But otherwise, 7th grade is pretty standard for you to start, you have no idea of their family history, or you just want to check?
Yeah, that's school district dependent. So, obviously Brevard has put a policy in for that, but there are other counties that have also implemented policies. There's also other countries that have implemented policies for EKG screening, all at different times. There's no data to suggest when is the best time though to look. Okay, so if you do an EKG at one point, let's say you do it in 8th grade, just as an example, could their heart change between before puberty and entering puberty? It is possible. So.
Go ahead.
It's not a question, I just want to say thank you, Brevard, for doing this, because there's a girl on my daughter's dance team that is actually getting open heart surgery in 2 weeks because of this EKG, and this $20 saved her life, and she would have never known, because you just would have never known. So I know some people are like, this is ridiculous, or some people are like, oh my gosh, it's unbelievable. And I know there's like 5 kids that are having things done in this county, and I would have never thought it would be someone my daughters know, and so thank you so much.
So if you know that you have history on both sides of your family that, heart related, what should I be doing as a parent that's above and beyond the EKG, like making sure that my child's getting?
Yeah, so if your history were coronary disease, right, so if people had had early heart attacks, things like that, then one, making sure they don't smoke, lead a healthy life so that hopefully they don't develop diabetes over their lifetime, and that they get their cholesterol checked is the important factors for that.
One of the earlier slides you showed said the whole checklist of 14 for like when you get the physical. So is that something that automatically is on a pediatric physical, or do we have to specifically ask for that at the pediatrician's office when we go in?
Most of your pediatricians would be doing that. So I can't speak for all of them, but when you take go to your pediatrician for your well-child visit, they're catching those things in most offices. I can't speak for every single pediatrician in the county.
Thank you.
My mother had she always called it a silent heart attack. The bottom of her heart died. But is there such a thing as a silent heart attack? And what can I expect from family?
Yeah, so there is a difference between men and women with heart attack symptoms. So the women do get less symptoms. So, in the movies you all see men getting crushing chest pain, falling over with chest pain with a heart attack. So women are have much less clinical symptoms with that. So I have a personal friend, she had a heart attack. She sat home for 6 hours with this kind of discomfort. She has two middle-aged kids. Didn't want to go to the ER with it. So then decided to go to an urgent care, and then got transferred to the ER, and then got transferred right to the cath lab, and now has 2 stents sitting in her artery with that. But you will find a difference. Not everyone has overt crushing chest pain, with heart attacks.
Thank you.
One last question. This is actually directed toward the district. I'm a newbie. I recently relocated from Texas, so a lot of the policies are different. So I have the benefit of an outsider coming in and being like, oh, what's going on here? I totally appreciate the benefit of EKGs. I worry a little bit about access. And if it's another equity thing, I mean, if you have lower income people who are underinsured, how do we make sure that their kids can do this and this doesn't become like a class issue and who can participate in sports and who can't? So I'd appreciate just a response.
And you actually came from a great state, because Texas just passed it for the whole state, actually,
So in Brevard County, who we play for, we're a nonprofit. Thanks to grants from Parish, Health First, the Brevard Health Alliance, and a few others, any family who cannot afford it, free and reduced lunch, thanks to those grants, we're able to deliver those ECGs for free to those families. So So there really is no kid in Brevard County, specifically, who wouldn't be able to get an ECG, thanks to our community. So we go out to all of the Brevard County schools that have athletics, and we provide those ECGs. But real quick, I did want to do a pretty big shout out. Dr. Dadlani here, since June, has read over 4,200 ECGs, all as a volunteer for us.